Above all, New Orleans is a city that loves to celebrate. And right now, there is no greater joy than when a patient beats a killer virus. But Administrator Dr. Eric George introduces us to the other side of this pandemic at Omega Hospital.
We're entering the COVID unit now.
A rare, unvarnished look at life and death as doctors and nurses fight a disease they know little about.
I guess deep down you just felt like it was your duty to do it. Yes, I was afraid. I don't know. I just put all the stuff on and just went in. I don't know. And then you see the people and you feel sorry for them and you just do what you have to do.
And you guys have been doing this now for how many weeks? 3 weeks.
Omega is what is known as a Tier 2 hospital, usually performing outpatient surgery. Healthy patients come in, have surgery, then they go home.
And then now you're going to need your 2 pair of gloves, okay?
A little bit tighter.
Right, you see why the mirrors are coming handy.
But the nurses here suddenly found themselves dealing with life and death as the crisis pushed New Orleans area hospitals to the limit. It became a question of finding beds for the very sick.
How you doing, baby?
For the very ill, this is the only human contact they have.
Yeah, okay.
Caring nurses and doctors.
Can I get anything for you?
And her prognosis is grim. An 80-year-old nursing home patient with a DNR order, which means do not resuscitate.
Dr. George, one thing that really stands out to me, we've seen a lot of images of empty streets and empty buildings and empty schools, but this is COVID-19.
This is it. And it's when you tell patients and you tell people out in the public to be cautious and be careful, this is a real disease. And if you don't take care of yourself, the young people who can transmit this to elderly or immunocompromised patients, and this is what you do to them.
Mostly, they try to make her comfortable. Breathing is labored, and pain medication comes as often as possible. What hurts the staff are demands to reopen the United States, the push for business as usual right now.
And all they need to do is spend a minute in this room. It is absolutely the most frustrating for all of us in healthcare. We say to ourselves, our nurses come and they say, I can't believe that people ask us, is this disease real?
Like all other medical facilities in the area, Omega was pushed to the brink.
We've buried 4 of the 11 patients that were in this center. We have buried. And what it says to us is, we need more testing. We need more knowledge of this disease before we turn people loose.
The city of New Orleans is still suffering a hangover from Mardi Gras. Streets are largely vacant, restaurants just now reopening. At the time, New Orleans seemed like an unlikely COVID-19 hot zone, until you consider its annual party for the world, Mardi Gras. Hundreds of thousands of people came to the city just as the pandemic gripped the United States. But back in February, COVID-19 had not yet blossomed in the United States.
No one talked about canceling Mardi Gras at the time of Mardi Gras. It was never mentioned in any quarter. It wasn't a consideration for anyone. There was just a few cases, and I think in Washington at the time. It never occurred to anyone to quarantine anybody. It was unthinkable.
Count Ray Kannada among those who wish we knew then what we know now. Kannada takes part in the annual celebration, parading up and down the tree-lined streets with a group or crew called the Rolling Elvi. The parades are big and bold, over the top, just like Elvis.
New Orleans is a place where you're packed close to each other in music clubs, and it's black and white, young and old, native and transplant, tourists and locals all packed together.
Exactly 2 weeks after the end of Mardi Gras, physicians in this city said it was like a bomb went off. Suddenly, hospitals were overburdened, and New Orleans, as well as the state of Louisiana, were thrust into crisis mode.
In the aftermath, parades, public parties, and festivals were canceled for the rest of the year by the city's mayor, a potentially crippling blow to a city built on the service industry.
The mayor shutting things down, I mean, it was a necessity. It needed to be done. But I don't think New Orleans is necessarily worse than anywhere else.
Chef Scott Craig says Katie's, one of his 3 restaurants, is doing about a third the amount of business it did before the pandemic took hold of New Orleans.
And right now, I'm just trying to think about how long I can survive. We'll come back in time. It's going to take some time, and it's not going to be just some switch that you can turn off and on. You know, it's going to take time to recover from this.
No, that's perfect.
These are the ones carrying most of the emotional baggage. Nurses working long, difficult shifts, and say they have not had time to process the mental anguish of so much suffering and death. They all have stories. For Lee Nagy, it is the 100-year-old war hero.
He was one I cried for, because he was just, I heard he was a World War II pilot. I mean, he was a super cool guy, but he never bragged about it. All he said was, I'm a lucky man. Y'all are taking wonderful care. I'm so lucky to be here, and he was special to me.
The nurse in charge, Kelly Hodge, has had a difficult few weeks. One of her nurses died from COVID-19.
And so the last conversation I had with her, she could hardly breathe.
There is also the heartbreaking case of an elderly woman who contracted the coronavirus in a nursing home, but the tragic aspect is she did not need to be in the facility.
She had a shoulder surgery done, and her poor little husband couldn't take care of her, so he sent her to the physical therapy inside of the nursing unit, and she was going to be there for 30 days. On day 28, she spiked a fever.
The hospital was granted an exception, and husband and wife were reunited here one last time.
So we called this poor little man, and it's terrible. He's like, answered my prayers, because he got to see his poor little wife before she died. And she died shortly after he saw her, because I'm sure that's what she was waiting for.
East Jefferson Hospital, just outside of New Orleans. The staff is settling into what has become a sobering routine. Critically ill COVID-19 patients just keep coming. Conversations among the staff are muffled by protective masks. And, as always, safety measures to protect doctors and nurses from the virus that is so easily spread.
Let us get him a surgical mask.
68-year-old Dr. Hector Montalvo practices internal medicine here. He was on the wrong side of fortune. He got COVID-19. His wife was told to prepare for the worst.
She told me, look, they call me that if something happened to you because of this disease, they're gonna let you go. They're not going to resuscitate her because they're putting a lot of people in risk.
Montalvo was on a ventilator like this one for several days. He knows he is a lucky man to be alive.
And I'm so blessed. I came to the hospital as a broken man. I'm going home a blessed man.
As the pandemic hit the city hard, most of New Orleans streets are empty, but not everyone is home, self-sheltering.
I'm used to getting blood drawn every year,
Right.
As soon as she beat COVID-19, Mary Truxillo rushed to have her blood analyzed.
Trying to be able to help people make something positive come out of actually getting sick from this virus.
As an emergency room nurse, she contracted COVID-19 early on. Then she heard about a study at a research site at a health facility in Metairie, Louisiana called MedFarms.
Hopefully, by giving blood, we'll be able to come up with a vaccine for people, a treatment, just anything to be able to help.
People want to help, and it is a great feeling to see that our community has people like that.
Dr. Robert Jonfro is the medical director here.
The frustrating thing about this disease is we don't have any approved drugs and we don't have any vaccines. And that's what we work with. That's what we do.
Their webpage touts COVID-19 studies. Working with major pharmaceutical companies, the goal is to be able to replicate antibodies found in blood of people who have recovered from the coronavirus. After a series of aches and pains in January and being exposed to the virus while reporting on COVID-19, I thought it would be a good time to get tested.
I did not cough and I did not have a fever, so I didn't think that I had any chance of having the virus. It's only spending the last 48 hours in hospitals and hearing other people who've gone through that I thought, well, maybe I have been exposed to this. So a doctor is going now to, what kind of test am I going to have?
Serology.
Serology test. And that will pretty quickly determine if I've been exposed, or?
Well, it will tell you if your body has responded to the virus. So
It'll tell me if my body's responded to the virus, so it'll tell me if I got through this.
This is one of just a few coronavirus tests approved by the FDA for emergency use. A simple pinprick. The small amount of blood should determine if I had the antibodies showing I was infected and had recovered.
So if I'm completely healthy and not been exposed, nothing will happen.
Well, that's the way we think.
The finger prick test is very new, and MedFarms CEO says there are many, many unknowns.
We're hoping that the antibodies last long enough to protect us. They're not certain of that, if it lasts 2 months or 2 years.
So right now we're really trying to determine how long the antibodies will stay in one.
I owe you so much.
No.
Dr. Ashwin Jefferson has more than an infectious smile. He is a lifesaver. While East Jefferson staff tended to the sickest of the sick, Jefferson contracted COVID-19, but he beat the disease in about a week. Then he wanted to donate blood so antibodies in his plasma could help someone else. And that someone is Dr. Montalvo.
And I think that we are born by...
We're brothers.
Yes. Thank
So
you
I
very
think
much.
you might like Indian food now.
Thank you very much.
Jefferson is a kidney doctor and constantly preaches about the benefits of donation.
It wasn't fun being sick, but I was fortunate to get better. And I was curious to see if this would help anyone. And when the time came and I kind of found out what was happening and who was involved, I mean, at that time I wanted to just try and see what happens. I mean, I was hopeful.
It's life. I really, I don't know what could have happened if I don't have that option of receiving plasma or somebody who has recovered already.
That's incredible. There's no feeling, I mean, it's just, now it's been a week to kind of process.
Montalvo's turnaround was rapid, but he still has pneumonia in both lungs. And for those who underestimate what this virus can do, or pushing for hurried return to normalcy,
there are always going to be people who don't understand. But when they survive, when they have to go through this, or somebody close to them, I think that they will learn the lesson.
There is nothing like a success story for the weary staff trying to cheat death every day.
It shows how closely we work together when something like this gets pulled off quickly.
I'm glad you're doing better, sir.
Thank you.
Look forward to seeing you in the doctor's lounge.
Right, that's one thing. We're trying to get the antibodies to send them to produce them.
After 10 minutes, the cartridge breaks the news to me. Nothing.
So I'm healthy.
So you are healthy.
No sign of the virus or antibodies. For a prolonged period, MedFarms had 4 people answering phones around the clock, trying to set up appointments to be tested.
And so, you know, a lot of people in the past would say, I don't want to be a guinea pig for a study. And I'm like, you're not a guinea pig. You're a medical hero.
People like Mary Truxillo, who know what is at stake.
It is very serious. You know, for some people, they'll be completely symptom-free. They won't even know they have it, but some people, you know, it could kill them.
For all, discovering a critical breakthrough is something that cannot happen quickly enough. Ray Kannada is much more than an Elvis impersonator. He's also a minister, and has found that his job has changed drastically in a time of social distancing.
Some people are coming on a little unhinged, and I feel myself unhinged too after a while. You have a lot of endurance, and adrenaline gets you through the first few weeks, and then after that you start to have some interesting emotions.
A city with so much social capital has now found itself broken. No swagger, no songs, no celebrations.
it just shut everything down. Well, now there's nowhere to play, so the pandemic has just shut everything down. This is for me, it's like reading a history book. You know, this will be a part of history.
A very, very grim chapter. Gregory Davis has been playing his trumpet with the Dirty Dozen Brass Band 43 years. He cuts a lonely figure on stage at the historic Orpheum Theater in New Orleans and has no idea when he will be performing in front of a live audience again.
To see absolutely no activity in all of these places, it is like a storm came through and everybody's inside waiting for the storm to pass, except this storm is going to take months and months before it passes over.
The rich brass sound is the foundation of music in New Orleans, and Davis says the root of all American music can be found right here. But right now, legions of artists just can't make a living.
Jackson Square. Normally, on a day like this, it would be crowded with tourists, perhaps listening to a few street musicians, while they ponder where to go at night to listen to jazz and blues in the French Quarter. But the city has been silenced, and for all of their talent, many musicians struggle to make a living and do not have a wealth of resources to tap into at a time like this.
For those that are living gig to gig and have families to feed, or be able to feed themselves, a lot of times the gig was the rent, the gig was the grocery money.
This is a 1969 Gibson ES-335, popular blues and rock guitar. This is a 64 Gibson ES-175.
Steve Staples earned that head of white hair. He has been making a living playing music in New Orleans since 1964 and has owned International Vintage Guitar since '92.
We have, probably 100 clubs every night that have live music around town, 7 nights a week. Drive down Bourbon Street. It's clean. There's not one person on it. There's not one club open.
Staples sold just 2 guitars in the past 6 weeks. Usually, he sells about 2 a day. He has applied for each and every part of the U.S. government stimulus package he can, but
2 days ago, I got a letter saying that I wasn't going to get it from the federal government because they were out of money.
William Pete Walker says he can play anything, and he has lost much more than his income.
I miss my playing for my group, playing for my church, playing for all of the people. They died left and right.
It was like, well, we hope this don't come here. And as one of my old bosses used to say, hope is not a method.
Army General Russel Honore knows disasters. He was the man credited with turning around the government's anemic first response to Hurricane Katrina 15 years ago.
Good night, Alice.
He now lives in retirement tending to his horses in Baton Rouge, about an hour north of New Orleans. He quickly grew weary of the Trump administration, saying the pandemic was under control.
America and the world got to come to grip with. The reason it is a disaster is it has defeated you. The opposite of that is, if you had control of it, it wasn't a disaster, it was an inconvenience.
But it doesn't mean the virus has to win. Now, he says, is the time for testing, then trace the outbreak and contain it.
And we need to focus on what we're going to do in the next 6, 10 to 12 months to limit the amount of people that die, because the most important thing in a disaster is keeping people alive. All right. Well, I happen to be in that 3 to 5%. I'm a minority. I'm 73 years old. I've been treated for heart and respiratory issues. So I don't have much chance of surviving.
Honore's world has changed, maybe forever, saying it will be a long time before he feels comfortable shaking hands again.
So they wanted to bring some stamina.
One of the most spiritual
cities in the world. It just all came to a halt.
One of the most iconic performers in all of New Orleans is Kermit Ruffins. He spends many of his days in the historic Treme neighborhood at his club. This is a city that encourages everyone to brace each other, but hugs have given way to friendly waves.
I think everybody's going to be doing that for maybe a year to come or longer, where we'll be outboard and staying distance. I mean, we kind of adapted to this now. I mean, it's a way of living right now. I mean, nothing else we can do.
Artwork of musical legends is cropping up around the city. Gregory Davis is the son of Miles Davis. Everyone wants to get back on stage and put money back in the bank, but they want safety before song.
And now it's just unbelievable that some cities, some states are talking about, starting up and opening up. Who wants to be a sacrificial lamb to earn a few dollars?
They have been called heroes, and they are on the front lines as they wage a war fighting an invisible enemy without weapons and very little support. Their best hope, not to see another patient die.
What's really sad, Sean, is we're not allowed to have family members come in with these people. The only people they spend their last breath holding hands with are our compassionate nurses. And they don't...
Not long after this interview, the 80-year-old lost her battle with COVID-19. Not a statistic, but a terrified and frail patient who battled overwhelming odds. Someone doctors and nurses want you to remember.